Brigadier General Nelia Fernandez Valmonte, O-118500 AFP. The 24th, the Chief Nurse Armed Forces of the Philippines, assumed her position on 7 August 2015. Her journey to the peak of the organization was never easy. Her prolific career was tainted with difficulties, personal and professional trials. But like a strong and honorable person that she is, instead of backing down with all the bricks that was thrown at her, she has built a castle out of them. Brigadier General Valmonte is a living proof of someone who conquered the rigors of military service and emerged triumphant, an epitome of a new generation Florence Nightingale, considered as one of the pillars of the Nurse Corps organization. Upon her assumption of office, Brigadier General Valmonte sharpened the values and ideals of the Nurse Corps even more. She initially prioritized the changing of the culture of the Nurse Corps organization, which is geared towards more compassionate Nurse Corps officers to their patients and towards each other as well. Brigadier General Valmonte worked tirelessly to lead the 398-strong Nurse Corps organization towards its goal. She advocated the numerous training and education activities and supported the thrust of the AFP Transformation Roadmap to focus more on humanitarian assistance and disaster response operations. This paradigm shift is where Brigadier General Valmonte's vision were anchored on. She envisions all officers to have training on incident command system, all junior officers to be trained on emergency medical services, advanced cardiac life support, emergency tactical combat casualty care course and airlift training, and mental health and psychosocial support. Indeed, the services of the Nurse Corps officers are not confined in the patient's bedside alone, but whatever and wherever the call of duty was. Whatever task and responsibility placed on their shoulders, you can expect an outstanding output from the hardworking and diligent Nurse Corps officers. With her guidance and direction, the Office of the Chief Nurse AFP has gained glaring accomplishments. In its commitment to service excellence, the Office of the Chief Nurse AFP has conferred the AFP Transformation Roadmap Institutionalization Pathway compliant status on 28 April 2016 for successfully establishing the tools and mechanisms, systems and processes related to the execution of Office Performance Scorecard. In the area of administration and supervision, the Office maintained its operational readiness in terms of personnel, facilities, vehicles and equipment. Likewise, facilitated the efficient management of financial and people resources to support the operational, team building and morale boosting activities. Noteworthy is the conduct of first Nurse Corps Recognition Day on 23 June 2016. In terms of policies, the Office of the Chief Nurse AFP spearheaded the crafting of the following: Healthy Lifestyle Awareness Program on the prevention and control of chronic lifestyle-related non-communicable diseases in the AFP. Proposed the creation of metal badges to honor the achievements of nurses in the AFP who successfully hurdled the training and achieved the degree of expertise in their respective field of specialization in the areas of OR, ICU, ER, pediatrics, psychiatric, and the like. Participated in the crafting and subsequent approval of the terms of reference of ASEAN Center of Military Medicine, which aims to strengthen and develop the establishment of practical, effective, and sustainable cooperation among the military medical services of ASEAN member states, whose goal is to live in peace with one another and the world. An active core group for the revision of nursing bill and the development of field manual and guidelines, and course development manual for the management of the dead and missing by the Department of Interior and Local Government, took an active part in the crafting of the AFP implementing guidelines for the Omnibus Implementing Rules and Regulation Rule No. 4 on foreign medical, surgical, dental, veterinary, and nursing mission on the Visiting Forces Agreement and the approval of the new OTCN TOE. To assess the performance of nursing service personnel, evaluate the level of satisfaction of the military personnel confined in the different military treatment facilities, and monitor the implementation of plans, programs, and policies of the AFP nursing service. The Chief Nurse AFP conducted staff and hospital visitations to 34 military treatment facilities. The Office of the Chief Nurse AFP continuously expanded global frontiers by strengthening ties with other nations, where Nurse Corps officers actively participated on international exchanges and exercises, to include the ASEAN Defense Minister meeting in Russia, initial planning conference for the joint conduct of joint military medicine and humanitarian assistance and disaster response training exercises in Thailand, Asia-Pacific Military Health Exchange in Vietnam, Health Aspect of Disaster Course in Australia, Association of Military Surgeons of U.S. Annual Convention in USA, AMHEX Mid and Final Planning Conference in Japan and Thailand, respectively, Network of ASEA's Defense Institute Track 2 in Thailand, 6th ASEAN Chief of Military Medicine Conference and Pacific Partnership 2016 in the Philippines, and Asia-Pacific Military Health Exchange in Malaysia. All this have been made possible by Brigadier General Valmonte's steadfast commitment and consistency, unity of the Nurse Corps, and support of the AFP. Under her strong leadership, she was able to surmount the trials and adversities faced by the organization. With her situational leadership style, whenever certain need arises, she makes sure decisions are made for the good of the people and the organization as a whole. Brigadier General Valmonte believes that trustworthiness, honesty, and transparency as true traits of a leader. As Brigadier General Valmonte bows down from her more than 3 decades of active military service, she is confidently leaving a stronger and better Nurse Corps organization that is ready to face future challenges that lies ahead.